Hey everyone. So thank you all for voting in the latest social media poll. ACL was the clear winner, so that's what we're going to talk about today. So I'm going to speak about what your ACL is, what its main job is, how you injure it, some differences between men and women and the ACL, and then your options after you injure it, whether it be surgery or not. So, your ACL or anterior cruciate ligament is one of the four ligaments that provide stability in the knee. So, basically, if you've got your thigh bone, if you imagine this is your thigh bone, and this is one of your lower leg bones, your tibia, um, the ACL sits in the knee in between, and its job is to stop this tibia from coming forward like that too much, so it prevents that forward translation, we call it. It also helps to provide stability during twisting motions as well. Um, so, how do you injure it? Most of the time, it tends to be when the foot is planted and the knee is locked out and there's a twisting motion. Um, then often a pop is heard and there's quite a bit of swelling at the time that comes out in the knee. It might be difficult to take weight on it, and the knee may even feel like it wants to buckle or give way on you. Um, it can also occur when you get a direct blow to the front of the knee, like say a fall when skiing, or say playing football and you get a bash to the front of your knee in a tackle or something. So common sports can occur in anything where there's stopping, starting, jumping, landing. So basketball, football, GA, rugby, netball, any of these types of sports, skiing, like I said. So that's how it happens. And like I said, you're looking out for those sorts of symptoms afterwards. Then to get a good diagnosis, you would present to your doctor or your physiotherapist, who would go through a thorough physical examination, looking at the movement in the knee, swelling, all the rest, and then do a particular test that movement and see if we're getting that translation forward. If we are getting that, then the likelihood is that you have done some damage to your ACL. So you can sprain the ACL without doing any tear to it. You could partially tear some of it, and you can also fully tear the ligament. So depending on what you present with, it might be wise to advise you to get an X-ray or an MRI scan to rule out any other damage to the knee, be it cartilage or other ligaments. So, and then from there, depending on how what comes back, the decision is whether you need to have surgery or not. So, if you're a young athlete who tends to play at a high level and your knee has been buckling or giving way, chances are that you will need to have surgery to help alleviate this or fix this and get you back to your sport. If you've also had quite a bit of damage to the other ligaments and the cartilage in the knee, then chances are again you're going to need to have surgery. But I would stress that you discuss this with an orthopedic specialist, knee specialist, to make the most informed decision for you. There's also quite a bit of research though coming out which does say that people can rehab after an ACL injury and not need surgery. So if your knee is stable, it's not feeling like it's giving way, and you don't play high level sport or play sport which involves quick changes direction, jumping or landing, then the research is coming out saying that you will be able to rehab this and get good function in your knee without needing any surgery. So I also spoke earlier about the differences between men and women when it comes to ACL. So women tend to get the injury, be more prevalent, we'll say, with women rather than men. So this is due to anatomical differences. So women tend to have wider pelvises. So what happens is during the rotation or the twisting movements, that puts more pressure on that ACL. And also the hamstring muscle, which is quite important as a let's say as a helper for the ACL, when you land from a jump, um, the woman's hamstring tends to fire a slight little bit slower than the men's, so then doesn't give that same support to the ACL, and then putting it at a little bit more risk. So after either you have surgery or you decide to go down the rehab route, rehabilitation initial stages, the big thing is about managing the pain and swelling in the knee. So be it your ice, gentle range of movement exercises, and very light muscle activation exercises. So trying to get, like I said, rid of that pain, get the knee moving, get rid of that swelling as well. And as time goes on, you're building into good strengthening exercises for hip and knee muscles. And a big part also is getting that feeling of stability or control back in the knee. So that's often lacking with these types of presentations. So we'll spend a lot of time doing some balance and stability work on one leg, really challenging that to get that stability and that control and that confidence back in that knee, really. So the rehab itself can take anywhere between 9 and 12 months. There have been a few athletes, some All Blacks, who've got back within 6 months, but again, that wouldn't be normal or usual for this. So your physiotherapist will put you through a series of tests towards the end, some hopping, jumping tests, and some strength tests, so that he or she know that you're ready to get back to your sport. So that's basically a quick overview of the ACL. If you've got any questions, comments, or anything that you'd like to discuss, or anyone that's suffering or possibly suffering from this injury, then feel free to get in touch with us. Give us a call, and we can have a chat about this and go from there. Thank you. Bye.